Hi, welcome to our class on pregnancy, birth, and babies. My friend Eliza is going to be teaching this with me. She is an avid oil user. She is allowing her Heavenly Father to change her inside and out. And she has helped lots of ladies with pregnancy and labor and delivery. Here's Eliza.
Wow, Christina, thank you very much. But Christina's going to teach you the meat of this. What I'm going to do is give you some basics to help you to understand the meat of all of it. So, one of the things that we want to talk about is, how did all this get started? How did we all start getting to use the essential oils? Why are people turning to them? What are they? Things of that nature. A lot of people are turning to the essential oils simply because they are safe, they are effective, they don't have a whole lot of adverse side effects. They're cost effective. That's another thing. For one thing, why I come to the natural solutions is because the other things that I was trying weren't giving me the results that I wanted. And I'm a results oriented type person. I wanted it to work. We always have to remember that our Father created the earth, He created the plants. So technically that's where it all started. And like, for instance, this slide here that says has the magnified picture. You have the leaf of the peppermint. Well, what's that? Is magnified. They're the purple with the white sacs. Those sacs is actually where the oil is coming from off of the plant. And that's what we're putting in the bottle. And over here on the left-hand side, you see 1 drop of peppermint essential oil is equivalent to 28 cups of peppermint tea. Okay, so if I'm feeling nauseated and I'm going to put 1 drop of peppermint on my stomach, I sure don't want to be trying to figure out how to drink 28 cups of tea to get to me what 1 drop will. And one of the things about the essential oils that we always want to remember is that they do penetrate that outer membrane of the cells, and they get in there and they deal with the things that are causing us to have our immune systems compromised. And it's going to support our immunity. It's going to support our immunity to do exactly what it's supposed to do. Every system of the body is supported with the essential oils. And the beauty is frankincense is the father of essential oils. It is the oil of truth. Okay, and with the frankincense, if I put a drop on me, and let's just say I have we'll stick with nausea. Let's just say I have some nausea, and I'm thinking, okay, well, maybe the frankincense will help me. It's not going to go over here to my big toe and make the callus come off my big toe. It's going to go to my stomach where I need it. And that's the beauty of the essential oils, is it's going to go right where it needs to go. It's not going to go to all the other cells that don't need it. It's going to go right where it needs to go. Okay. Then, so why choose doTERRA essential oils? Well, one of the biggest reasons why I can think of is because of the way they are tested. They are tested in the fields. They are tested at the distillery. They're tested in the shipping process. They're testing in the bottling process, and they're testing before they're released for sale. So what are they testing for? They're testing for purities. They're testing for impurities, excuse me. They're testing for quality. They're testing for anything that might bring about something that's going to alter those essential oils from being something that you can trust, you can depend upon, and you can know that if you open up a bottle of lavender today and you open up another bottle years down the line, a brand new bottle, it's going to be just like that first bottle that you tried, because it's going to have a standard that is set that is far beyond most standards. The testing that they use, some of them are listed here, but there are even others. Okay. There's other things that they do with their testing. There's other ways that they set things up, and they are making sure that we are getting quality and purity with everything that they send out. And to me, I don't know about you, but that's pretty doggone important. Okay, so this other thing here is a price per drop list. Okay, looky here. Lemon is in the second column up at the top. Okay, if you look, you go all the way to the right. That's the wholesale cost. That's 4 cents per drop. Okay, I put 5 drops of essential oils in a 28-ounce glass bottle, and I do that 4 times a day. So that's 20 drops. Okay, you think 4 times 2, 8, that's 80 cents. Okay, 80 cents. You can't beat that. So, you know, you're using the lemon to help keep your immune system up, to help keep your system clean and going and keeping you refreshed and revitalizing for 80 cents a day. You tell me what you're taking that you can get that many benefits from and uplifting to your mood for 80 cents a day. Okay? All right, and then we want to cover, before we let Christina loose, we want to cover ways that these can be used, okay? So they can be used aromatically, which means you can breathe it from the bottle. You can breathe it from a diffuser. They can be taken and used topically, which means putting it directly on the area, putting it on the bottom of the feet, putting it into your hands, rubbing your hands and breathing from it would also cover topically and aromatically. And you could do it internally. Put it in a capsule, put it in a glass of water, put it under your tongue. Neat means can be used topically with no dilution, means nothing's added to it, no carrier oils of any kind. Dilute for young, sensitive skin, and I'm sure that Christina's going to cover that one even more, but it is always wise to dilute it a little bit with those youngins. And then you can also dilute it before using topically, just simply because it helps it to absorb at a slower rate and more consistently over a period of time. And so that is always a good thing. And of course, we have some of the best fractionated coconut oil available because it don't even stain clothes. And I always like to tell that one. The other thing is our sourcing. We source our oils from the area that is going to give us the best quality, the best constituents. I can grow peppermint all day long right here in Bristol, Tennessee, but it's not going to bring to my peppermint what it needs because the environment's not right, the soil's not right. There's a lot of things that Bristol, Tennessee is not going to give my peppermint to give me that top quality peppermint that I want. But I can go to Washington State, where our peppermint comes from, and I can go out there and I can be guaranteed that that peppermint is going to have the highest quality peppermint because it's coming from the area in which it needs to come from. That's always good. Impact sourcing is always important because we're giving back as much as we're getting. We're making sure that these people are not having their lives stripped from them by a third party in the middle between them and doTERRA. doTERRA says, oh, no, we're not doing that. They go directly in. And Emily Wright is the lady here in this picture hugging this elderly woman. And to me, this is the picture of co-impact sourcing. This is where we're supporting our growers, their families, and our communities, and we're giving back as much as we're getting. And on that, here comes Christina. Let me tell you a little bit about her. She is this wonderful, caring, loving woman who has a fabulous husband, and she's got 3 children. She's recently, in the month of October, if I'm not mistaken, gave birth to a little girl that she's going to tell us more about. And she is a princess warrior, daughter of our Father. And without further ado, let's hear what she's got to say. I can't hear you, Christina. You muted yourself.
I did because my little girl is talking. Anyways, okay, so in our home, we use the Touchline generally for Talia. It has that coconut oil in it, so it's easy on her delicate baby skin. We apply the oils every time we change her diaper. That helps keep a nice even level in her body because her body is metabolizing those oils just like food. So it's just a good trigger for me. If I change her diaper, you know, her feet are bare, her stomach's bare, I put oils on her. Like I said earlier, we either dilute the oils for Talia or we use the touch lines. And we diffuse for her a lot. And also some of the research I found talked about diluting for premature babies because their skin is just so thin that you really don't want to put any type of essential oils on them directly on their skin. Oh. That's Talia's opinion.
I was just fixing to say she's going to help you teach this class.
And then also reflex points. I really believe in reflex points and use them quite often on all of us with our oils. And actually, I even used reflex points while I was in labor. With each of my labors, when my mom and my sister with this last labor and delivery squeezed that reflex point on the inside of my ankle, things really, really changed and started happening. With Talia, that's actually the point when my water presented. Everything was just kind of moving along slow, and when that happened, everything really, really picked up. Let's see, let's go on to the next slide, please. All right. We started using oils on our children right at birth. We put frankincense and myrrh on Talia to promote her health. That the frankincense is just, it's an all-around oil. When in doubt, get frankincense out. And then myrrh and frankincense are going to help promote bonding with her family outside the womb. And so we went ahead and we put that on her feet. And then we diffused it in the air in our room at the hospital also. And then beyond that, right after birth, you're the best judge of what your baby needs. Do they need health support? Do they need a little bit of mood support? Immunity boost? Or they just are having a hard time sleeping and adjusting to life outside the womb? For Talia, she had some meconium present, and so we put Breathe on her to help support her respiratory system because she was really struggling with getting enough oxygen into her system. But you, like I said, Heavenly Father has gifted you with the judgment you need to know what your baby's going to need right after birth. All right, I'm just going to kind of run through a couple common issues that babies have. Too much yeast. You can apply Melaleuca to the baby's tongue with some coconut oil. And then you also want to make sure that you put Melaleuca on your nipple also, because you can actually start passing that yeast back and forth. So as soon as you get it cleared up in the baby, you could pass it right back, which is no fun. Liver support or yellow skin. You can use geranium and or lavender on the baby's feet. And then you also want to make sure that that baby's getting plenty of indirect sunlight on bare skin. So wrap them up in their diaper and put them in a window and then some nice warm sunshine. Tummy trouble. Oh. Digestion and is great across, just a little bit across their tummy and on their feet. And then also pay attention to your diet. If you have a little one that's really struggling with upset tummy, you might want to keep a food journal, and then a journal also of how that baby's reacting to what you're eating. I know with Talia, I've got to completely avoid all dairy. If I have dairy in my system, she's got an upset tummy. And digestion helps, but getting ahead of it with my diet is the best thing for Ear discomfort, Melaleuca and lavender. The Melaleuca is going to help with whatever is going on that's causing the discomfort, and then lavender is just going to calm them down and soothe that little baby. You can put it around their ear and then just slide down the neck, kind of where your eardrum is. Immunity boost, On Guard, and then lifelong vitality in your breast milk. You'll hear me mention lifelong vitality a lot. It's one of my favorites. Diaper rash. Again, sandalwood and or myrrh with a little bit of coconut oil. Or in our house, we're all about ease and quick, easy applications. So Correctex is great. You can just keep that in your diaper bag or right there wherever you change your baby and have it all mixed up, ready to go. Teething. You can put white fur directly on their gums, or you can use clove. Clove, however, is a very hot oil. So if you do choose to use clove, you're going to want to make sure you mix it with at least a tablespoon of coconut oil before you put that on their gums so that it doesn't cause any irritation. Infected eyes. You can use On Guard on the baby's feet, not in their eye, and then lavender on the little one's feet. Or, and my children are still giving me a bad time about this one, you can actually squirt some of your breast milk directly into their eye. Heavenly Father's designed our breast milk to have a lot of enzymes and right in there. So if you squirt just a little bit out into their eye, it will actually clear that infection up. And we actually got to try that last week, and it worked really well. Fever. You can use peppermint and coconut oil on the back of your little one's neck and diffuse it. I know for older children and adults, we recommend you can actually put it right across the forehead, but with a baby, you don't want to get that peppermint in their eye. So I recommend just putting it on the back of their neck and down their spine. And then patchouli also, you could put on the back of the neck and down the spine. Dry skin. You can use any of the body butters or the hand lotions from doTERRA. They're loaded with all sorts of fun stuff. Even just the plain hand cream has really amazing ingredients. And then you could also use coconut oil with a few drops of Serenity or lavender to help soothe skin. Some fun things that we've made at our house are diaper cream, and then the baby powder. And then one of the Living magazines had a fun baby shower ideas. And then Stephanie Fritz, which actually I should show you guys that book. Stephanie Fritz is where I've gotten most of my info from. She has a really fun diaper bag makeover that you could do. And actually, if you know someone that's getting ready to have a little one, that could be a fun gift for them. And then over there on the right is just the list of what we keep in our diaper bag. And then in the middle is some pictures my son took of the oil cases we keep in the diaper bag. The top one is the Touchline with chapstick, because the only thing I'm addicted to in life is chapstick. And then the bottom one is what we call our emergency oil kit. It has all the oils that my family uses on a regular basis. And then there's a twofold with this one. You'll notice there's an oil missing there from the second up from the bottom row. I also use that case as a sample case. So if I'm out and about and someone needs a sample, I've got a perfect little sample made up for them. Oils for mama. We often forget as moms to take care of ourselves first, to put that oxygen mask on ourselves first. So for myself, I put oils on every time I eat. I try to eat 6 small meals or snacks a day, just to keep my metabolism up and going. And so then again, just like with your little one, the oils are going through their system or through your system like food. So every time you eat is a good trigger to remember to get your oils on. And remember, for you and your baby, 1 drop is enough. At any time, your body is going to metabolize that and use it up. And then for mamas, make sure that you're preparing for ease. I keep things by my chair. I keep my water there. I keep my Deep Blue rub. And this thing's set up so that when I'm nursing, I can take care of myself and Talia without a lot of hollering for help. And then I also keep my diffuser right there. In our home, we kind of switch off who gets to choose the oil blend for the day. And so the diffuser sits right by that chair where I'm nursing. So it's just a, sorry. It's just a good trigger for me to remember to make sure that diffuser is still full and to turn it on every time I sit down and nurse Talia. Some baselines for healthy pregnancy and then raising a healthy little one is healthy, clean foods. You want to make sure that you're getting plenty of healthy, clean foods to help your body do what it needs to do. And then in turn, give that baby healthy growth in the womb and outside the womb through your breast milk. And if you need some ideas, I use the TerraFit program a lot. And they have a great list on their website of healthy and unhealthy foods. You want to make sure that through your pregnancy and the time that you're nursing, that you're getting 80 to 100 grams of protein, so that your body is not lacking in any way, and you can have the stamina and energy to do what your body needs to do. Water. I don't go many places without my Voss water bottle. And just like Talisa, it's got lemon in it. I recommend half your body weight in ounces. So if you weigh 120 pounds, you're going to drink 60 ounces of water a day. That might sound like a lot, but once you work up to that half your body weight in ounces, your body actually craves it, and you know if you're going without it. And that's a quick way to eliminate a lot of the side effects we have when we're pregnant or nursing, like headaches and or bloat and indigestion. It's just drinking enough water. You want to make sure that you got low sodium intake to cut back on swelling, especially towards the end of your pregnancy. And then just pay attention to what you're eating. Of course, processed foods are going to be higher in sodium. They're also going to be higher in sugar, which you want to avoid. And sugar actually is one of the leading causes for bleeding when you're in labor, and then in your recovery also. So cutting back on sugar has a big effect on making sure that you stay healthy through your labor process. All right, so taking care of yourself during pregnancy and then after you've had that baby. A few things that you can use is Exiomega. For the omegas in there are really going to cut back on any bleeding that you would have. And then you could also use Helichrysum over your abdomen. Now we had Talia in the hospital, and when the nurses were coming in and checking on me, they a few times were actually concerned that I was clotting because I wasn't bleeding near the amount that they would normally expect. So when they're going, you're not bleeding, we think you're clotting, and I'm going, no, I think I'm okay, and I was okay. It just the Exiomega and the Helichrysum over my abdomen were doing their job to help me heal up really quickly. The IV sites, if you're in hospital, they want IV in your arm. So frankincense and cypress can help reduce or eliminate any of that purple bruising marks. Dry or cracked nipples. You want to make sure that you've got a proper latch for that little one. And don't be afraid to ask for help with that. Ask friends who have nursed, or ask a lactation specialist to help you make sure you get a good start to nursing to avoid a lot of trouble. But I think no matter what you do, you're going to have a little bit of discomfort. So myrrh, geranium, sandalwood, along with coconut oil right over your nipple. And you don't need to worry about getting that off before the next time the baby nurses. It's okay if they ingest those oils with that coconut oil on them. And then for quick grab and use, you could use the herbal chapstick or Correct-X. For myself, I used a lot of the herbal chapstick. Stamina to make it through those sleepless nights. If you're like me, you don't really sleep when you're pregnant either. So I took my Lifelong Vitality morning and night, and then I also added in Mito 2 Max while I was pregnant, just to help keep my stamina going. Mito 2 Max is a caffeine-free blend to help boost your whole self. And then Lifelong Vitality are the bioavailable vitamins that are just loaded with everything your body needs in a proper amount to be absorbed and used well. Milk flow. Again, back to the diet. Make sure you're getting plenty of proteins and water. Healthy, clean foods. And then on top of that, you can use fennel to help increase your milk flow, or peppermint to help decrease. If something's happened, and you're not able to nurse your baby, you could use peppermint. Or if you've just got a major overflow. Inflamed breasts or clogged milk ducts, you can actually steam cabbage and then take that steamed cabbage leaf with wild orange and lavender and put that right on the breast and kind of make like a poultice. Sleep fast is something we say in our house a lot when we've got to go to bed late and get back up early. You could put balance and lavender on your feet. You can put juniper on your feet or on your pillow, or vetiver. Or you can diffuse any of these oils, and they're going to help you just go to bed and get a restful night's sleep. But they're not going to knock you out. You'll be able to wake right back up and feed that baby or tend to your family. All right. And then postpartum blues. A lot of times after you have that baby, a couple weeks go by, the newness wears off, and you're tired, you're done, you're exhausted, and you're not so chipper. Lifelong Vitality is going to help your body recognize and balance out your emotions. And then phytoestrogen also is going to help your body level out your estrogen levels and help with that, help you not be so sad. Balance, Serenity, clary sage, bergamot, whisper, and frankincense are also great oils to help level out your moods and your emotions during that time. And just remember, 10 to 15% of women do struggle with that. So it's nothing to be ashamed of. Ask for help. Let your family know what's going on, and make sure that they're reminding you to use your oils and to take your Lifelong Vitality no matter how fatigued you are. Also, something we kind of forget about is our support team. So when you're pregnant and in labor, and then after you have that little baby, the people around you are very important. When we had Talia, she was about a week late, so my brother and my sister were actually already here. And the morning that I went into labor, my poor brother was beside himself and just really kind of a babbling goofball. So I made sure I had my son, actually, Riley, went and got Console on Zach. And rosemary. And console was just to help him console himself and deal with his emotions. And rosemary was to help his brain turn on and perk up, because he needed to drive my children to the hospital. So I needed him alert and aware of what was going on. You can use any of the emotions oils to lift moods. You can use serenity to lengthen patience. I think one of my sisters on this call, so don't get upset with me, but my sister Hillary was here, and when Talia was late, she was getting a little frustrated. So we were using oils to help her be a little more patient with the natural processes going on. Ease transitions. My son Riley uses lemongrass because he has a bit of an issue with letting go of his position in the family. He's 12, so he by no means was a baby, but he is no longer the baby. Also, you want to make sure that you're supporting everyone's immune systems, making sure that nobody's sick or ill while you're pregnant or while there's a little one in the house. So you can use On Guard and Lifelong Vitality to help, or juniper berry for restful sleep, and purifying your laundry. We put Purifier On Guard in every load to make sure anything that is on our clothes is getting handled. Get oils on that baby. Talia was born in October, and the only thing she's ever known is essential oils. And to be honest, I was talking with a lady last night at a church meeting we were at, and her daughter also uses essential oils. And we were comparing notes on how happy essential oil babies are. They just, right from the get-go, and even during your pregnancy, their bodies are being supported and they're being given the best chance they could have at a healthy, happy life. And her and I noticed a difference in essential oil babies versus non, at how happy and cheerful and alert they are. And let's see, I'm thankful that doTERRA has given us that, the education and the pure oils that we need to support our families. With that, I'm going to turn it back over to Lise so she can tell you how to get your oils on your baby and on you. Are you there, Lisa?
Yes, I'm just talking away and you can't hear me. Okay. One of the things I wanted to say before I get into the next part of this is even in Stephanie Fritz's book, which is the one that you mentioned, she talks about use the oils all through the pregnancy. There's oils for nausea. There's oils if you can't sleep. There's oils if you're having difficulties with comfort. There's oils for if you're having problems with appetite. There's oils for all of that. So be willing to use them. If you're using something now to support your respiratory system, you can use it while you're pregnant to support your respiratory system. If you're using something to support your urinary tract system, right now, you can use that while you're pregnant. She is a midwife, Stephanie Fritz is, and she very much highly recommends using the oils throughout. There is even information available for people who are trying to get pregnant. And the foundation of trying to get pregnant, being pregnant, nursing that baby, the foundation is good nutrition, first and foremost, water, supplements, and then you put the oils and stuff in. But if you're eating bad, you're not going to be able to change anything if you're eating bad. And I just wanted to say that because, and there goes Christina drinking her water. Yay! I just wanted to say that because Christina and I did this class the other day and I took the pregnancy part and she took the birth part. And since we were bringing this out to the public, we wanted to cover some of the basics too. And I didn't want us to leave out the core of the pregnancy. And the core of the pregnancy is whatever you're using the oils for today, you can use the oils for during the pregnancy. Would you agree, Christina?
I agree. Thank you, Eliza, for pointing that out.
Okay. All right, so now I want to talk to you about the Loyalty Rewards program. It is 100% completely optional. Nothing are you obligated to do. Once you have started a membership, you're not obligated to do anything. You're not obligated to order anymore. You're not obligated to do the Loyalty Rewards program. You're not obligated to anything. It's a choice of what you do. The bottom line is the more you participate, the more you earn, the more you get, the more free you get, okay? And I use that literally, the more free you get in health, everything. So if you enroll, you start out with a 10% back in product points. Every product has a point value, or I should say almost every product has a point value. And you get points back. Okay, so if you, let's just keep this simple. If you order $100 worth of product, you're going to get 10 points back. And guess what? You can get a bottle of lemon for that 10 points. Okay, that's what the points are about, is what can you get for them. So if you're with us for 13 months and you are doing what qualifies you to be able to increase every month, you get up to 30% and you order 100 PV worth, you get 30 points back. Guess what? You get to spend that like 30 bucks if you watch what you're doing. I have never bought frankincense, but the first 2 or so bottles, the rest of it has all been bought with my points. That's a huge blessing. Huge, huge, huge. As you can see from the slide, it's 1 to 49 PV to maintain. In other words, you place an order that is worth either 1 to 49, anywhere between there, and you maintain where you're at. Let's say you get to 15% and you don't have the money to make an order that's big and huge or anything. So you order a thing of chapstick, okay? And that way you maintain where you're at. But if you would like to advance up to that 30%, then you need to place a 50 PV order every month till you've reached that 30, and then you can set it to maintain if you would like to. And you receive free products. If you order 125 PV every month, you get the free product of the month. It is a wonderful program. I love my loyalty reward program. I get free product every month. Never fails. I love it. New year, new you. Because you are viewing this video with me now in present or in recording, you are qualified for this promo. So what that means is if you, right now, between now and the 15th, once the 15th rolls around, this first one is off the table. But if you order a 200 PV order of any kind between now and the 15th, you get a free bottle of frankincense, which is a $93 value. Okay, so there's promo number 1. Number 2, because you are attending this class, that means you qualify for the New Year, New You all by itself. You order within 5 days of this class with a 100 PV order. You order a 100 PV order in the next month, which would be February, you get 100 PV free. So in other words, you're going to buy 2, get 1 free. You're going to buy 100 PV this month, 100 PV next month, and you'll get 100 PV the following month. And you're going to do this with an LRP, which is what we were just discussing about getting those points back. So you're going to place your order. That will not be LRP. That will not be points back. Then you'll place an order for 100 PV and you'll get 10% of that back in points. And then you'll get a whole 100 PV free the following month. Folks, what that boils down to is you get 110 PV free to spend like $110 if you choose to spend it that way. So right now we're looking at 110 essentially PV dollars free plus free frankincense if you place a 200 PV order. That's a pretty awesome deal. Okay, this is only through the 15th to get all of it. Okay, you have 5 days from today to participate in just the New Year, New You part. Membership is $35, but if you're ordering a kit, you get to waive that fee. That's an awesome thing, in my opinion. So the summary is you order with 200 PV within 5 days. Actually, this is now the 12th, 13th, 14th, 15th. You've got to order by the 15th. So you've got 3 days to place a 200 PV order and get the free frankincense. But you also get the opportunity to have another 110 PV for participating in the New Year, New You promo. Okay, I've got to see. Can you see what's at the very bottom? I've got a note, but I can't see it because of what's there.
Athletes kit is 10% off this month with any order.
Okay. Yes, I wanted to throw that in. If you want to know more about that, please talk to the person who invited you to this class or whoever has been sampling you, because that is a pretty nice little kit too. All right, so kits, if you're where you can see it, I have a picture. We're not going to go through all these. We've got the Aroma Touch diffuser kit. We have the Family Essentials kit and beadlets. We have Clean and Restore kit. We have the Family Wellness kit. We have a Home Essentials kit. We have Natural Solutions kit. We have the Oil Sharing kit. We have every oil kit. We have every product or the Diamond kit. Talk to the person who invited you and let them take you through these kits and show you what all the perks are. The Athletes kit is not an enrollment kit. The ones I've just read off to you are enrollment kits. They're the ones that's going to get you that $35 waiving of the enrollment fees. Y'all, the bottom line is, if there's anything you want to do in life, you can do it with an essential oil and make it easier on yourself. Whether it's heal from emotional wounds, be pregnant, get pregnant, have a baby, nurse a baby, have a husband. Trust me, sometimes you need a bottle, but you know. No, seriously. Our husband, I don't have one of those things just right now, but the ladies that I know that has a husband, they talk about how even the husbands are highly affected by the essential oils, and it doesn't take but just a drop or two. Okay, whether it's in a diffuser or even if you just put it on yourself and go up to him, and whether he knows it or not, you may even be praying for him, and he's gonna change. So you can choose to go through life with or without the essential oils. I choose to go through with them because they are a gift from our Father. They are a huge blessing, and they make life easier. Christina, have you got anything else to say?
No, amen.
I like that. Okay, so I'm going to go over here and unmute everybody. And if you have any questions, I'm assuming that the Arkansas number is Miss Laura.
Yes.
Okay, and then we have Elka with us too. And of course, several people told me that they would have to watch the recording. Laura, do you have any questions?
I'm still thinking.
Okay, nice to hear your voice. How about you, Miss Elka?
No, I don't. I just wish I had these oils when I was pregnant.
Oh, tell me.
And had my kids.
Tell me about it.
I wish I would have had my first 2 pregnancies too. Never.
I helped deliver my 15th grandchild December 2015. And we used the oils with that child all through the pregnancy. Even though I wasn't with her the whole entire pregnancy, she had oils. And we delivered, and when I did get to her, she, we used the oils, we prepared her, we did a whole bunch of stuff. As soon as that baby was born, we were putting oils on that baby. I'm not lying to you, this baby is the happiest baby I think I have ever seen. And when Christina was talking about that, I'm just, yes, he is the happiest baby. He just, oh my goodness, she's got 4 other children. I had to count. Yeah, she has 4 other children, and none of them were ever as happy this early in the ball game as this one. My daughter's got several children. I've never seen any of her children as happy as this one child, because the oils were involved from start all the way through. When she started nursing, we had those oils. That baby was oiled up every which way. I even did a little bit of the aroma touch on her and the aroma touch on the baby while she was pregnant, after she delivered, and after that baby got in this world. That baby was old. Do you hear me? So you don't have to fear using them at all.
No.
All right. So if nobody has any questions, y'all can sit here and listen to me talk, or we can shut this thing down.
Well, I think I do have a question
Okay.
for Christina, right?
Yes.
What's your name? Did you have any opposition from any of the medical staff when you were in the hospital for using the oils?
No, and actually I forgot to mention that. Like I said, there was meconium and stuff, so things weren't quite going as planned. Everyone stayed really calm. I had my sister there, who is a confident oil user, and she was kind of running point with the oils. She had the diffuser going. She was putting oils on me. She was putting oils on my husband, and herself. And the doctor actually at one point looked around and he said, "I should be videotaping this. Everyone is so calm and collected." And I kind of laughed because I heard him say that loud and clear, and I almost kind of forgot about what I was doing because I was so proud of the moment.
Mm-hmm.
And then we made it clear that we weren't going to be doing a lot of the things that they do to have babies do right after birth. And they really respected that because we were confident. We had things, clean, set up, ready to go. The diffuser was off to the side, out of the way. My sister was very polite about when she would step in and put oils on people. And then even beyond that, I actually, because, we just had the oils out in the room, I had brought my box there, and the neonatal nurse actually came in and said, "Okay, everybody says you're putting oils on this brand new baby. Where are you putting them? How are you using them?" She was an oil user herself, but she had never put oil on. So we really didn't have any opposition. They were excited to see us using them, and didn't have any problem with it. So I think if you're confident, and like I said, you yourself can't be that person. You need to have someone there doing that for you, who's going to be confident using the oils. I mean, when we found out there was meconium, she got right on top of researching what we needed to do to support Talia to deal with that after her birth. So
I think a lot of people, or a lot of hospitals and doctors, are becoming more open to this, because this is a movement, for lack of a better way of putting it. It is happening, okay? It is happening whether they like it or not. It's just like at convention, doTERRA had a panel of, 9, 12 doctors up there. They're using them in their practices. They're using them in surgeries. They're using them with their patients. They're, the one OBGYN was talking about, that his mamas are getting massages, the surgery guy, he's talking, or the orthopedic surgeon, I had to think which one he was. He was talking about there's massages going on. They're using the essential oils. It is a huge thing. We know of a child that is a child of a doTERRA person higher up who received major burns, and oils were taken into that hospital and they were used directly on that child's burns, and the hospital was impressed. So I think, Christina, you're right. I think it's about our confidence and how I believe in birth plans. You have a birth plan, you make sure you're clear with your doctor. Did you talk to your doctor before the delivery?
No, I had talked to my doctor, but I got the doctor on call. So
gotcha.
that
Yeah.
I had never ever talked to before in my life.
Yeah. Well, I will bet you that your doctor had made a note in there about the essential oils. And by even talking to him about it and them knowing something about this coming in there, that made it more receptive to you. You don't come in and spring something on them that they're not aware that's coming in. You be very honest. And one of the things that I believe is that if you take into a hospital setting unopened bottles, clean products, things of that nature, it's also going to go across a lot better too. If you go in and all your stuff looks nasty and dirty and handled and hairy because you got hairs attached to it, they're not going to want that in there.
Yes,
It's
you're
coming from the nurse in me.
well, and that's, and that's, my sister was washing her hands before she put oils on people. I mean, we were doing a good job of making sure it was a official procedure.
Yes. Hey, that was a good point to make right there. Because if you look like you're handling yourself in the way that they would like for you to handle yourself, then you're going to eliminate a lot of flack there too. So, Laura, did we answer your question?
Yeah.
Do you have any more?
Also, I don't remember when I went to that meeting that Beth did.
Uh-huh.
She said that there was one kind of oil that she used that was helpful with like regulating your menstrual cycle and even like, I guess, helping you possibly get pregnant. Do you remember what that was?
Would that be the Claricom, Christina?
I would think so, yes.
That's what
And
I was thinking.
That does have clary sage in it, though, doesn't it?
Yes, it does.
So that is one to avoid while pregnant.
Is the Claricom or the Clary Sage? Because
Yep.
okay,
That's use labor, but you can use it before. And
I think you can use it. It's not that you can't use it during the pregnancy. It's the timing on the pregnancy, because you can use it to help with making the contractions stronger.
yes.
Yeah.
So you don't want to use it if you like. I've got a friend right now with a high risk pregnancy.
Yeah, she would not want to use it. No, but to help regulate your menstrual cycle and to possibly help get you pregnant, because it has a uterine tonic, not tonic, but uterine stimulation to it, and that it would help.
Yep.
Yep.
Yeah. Now, and I mean, I know from person, I was putting that all over me because my baby was late.
Uh-huh.
It didn't, I didn't go into labor until I needed to go into labor. So
no, and you won't. And you were talking about the reflex points. One of the places that we put the Clary Sage was on the reflex points, or Claricom, Clary Sage. We put them on the reflex points, and it does make a difference.
Oh yeah.
Yeah. So Laura, does that answer your question?
Mm-hmm.
And if you would like for me to get a hold of her, I can do that to verify that, if you would like for me to.
I mean, doesn't matter to me.
Okay, I will commit to finding out from her exactly what she said, but I'm almost 100% sure that it was going to be the Claricom, but I will verify that.
Okay.
Another one too that helps, I don't know exactly what you're trying to target, but for regulating cycles is the phytoestrogen. That supplement is really incredible. Beth does not use that one because she's allergic to one of the ingredients. But for everyone else who has taken it, it has had a really, really big I didn't say that very well. It's been very supportive for them with their menstrual cycles. And then also, even for me when I was pregnant, I should have mentioned that I took it, and the days I took it, my morning sickness was considerably better. Because it was level out my hormones.
Yeah, the phytoestrogen is going to levelize your hormones, and it's going to help me. See, in my case, I had a hysterectomy years ago, and I just started taking the phytoestrogen back in the fall, and I'm like, oh my word, do not take this away from me. I like how I feel on this. And I didn't realize there was going to be such a big difference, but there is a huge difference taking it than not taking it. So yeah, I definitely agree with that. And of course, bottom line is lifelong vitality is another one that I would really, really encourage. And I know that was one that Bethan had said something about, because it's going to help bring your body into a more balanced place, and everything else you use is going to help support that too. Looks like Christina's running out of time.
I am. The library closing on me.
Okay. All right. So if you don't have anything else, Laura.
Nope, I think I'm good.
Okay. And you can either contact me or Nicola if you have any more questions.
Okay, well, I appreciate you inviting me.
Oh, you're very welcome.
Thank you, ladies, for sharing your wisdom.
Oh, thank you. Christina, you did a beautiful job. Thank you.
Thank you. Bye, guys.
Bye. Bye, Elka. Love you.
No, you're fine.
Love you too.
Talk to you later, sweetheart.